and welcome to This is Public Health. I'm Pamela Kirkland with the West Central Health District here in Columbus, Georgia. And today we're going to be continuing our conversation about the COVID-19 vaccine. It's been a few months since we talked to you before about the vaccine, and joining us today is Dr. Asante Hiltz, who is our District Program Manager for the West Central Health District. Welcome, Dr. Hiltz.
Thank you.
Good to see you.
Great to see you.
We have a lot of changes since the last time we talked, and a lot more questions that people want answers to, so we're going to get right to it.
All right.
Okay, so first of all, now that we have 3 different vaccines that are available and have been approved for the emergency use authorization, tell us a little bit about each one of those vaccines.
So as you said, we have 3 vaccines available now. The first one that we have and that we started using was Moderna. The Moderna vaccine is a 2-dose vaccine separated by 28 days. So that vaccine is only approved for individuals who are 18 years and older.
Okay.
So they get the first dose and then they get the second dose 28 days later.
All right.
The second vaccine that we have is the Pfizer vaccine. It is also a multi-dose, 2 doses, and it's done in 21 days. So first dose and then 21 days later, the second dose.
Okay.
What's unique about the Pfizer vaccine is that it is currently approved for 16 and 17-year-olds. So teenagers are able to get the Pfizer vaccine.
Okay.
And then the third vaccine we have is the Johnson & Johnson vaccine.
Right.
It's Johnson & Johnson manufacturer, but the vaccine arm of Johnson & Johnson is called Janssen. So in case people get confused between the 2 names, they are the same, Johnson & Johnson and Janssen. And that is a single dose vaccine. It's the only single dose that we have, so it's just 1 shot. And that one is also required to be 18 years of age or older.
Okay, now a lot of people have asked this question a lot. You know, they're worried that they're going to miss their second dose. Does it have to be exactly at 21 days or exactly at 28 days? And some people are getting very, anxious about that. So kind of, address that situation a little bit for us.
Sure, and that's understandable, and we understand that people want to get that second dose right at their 28th day or right at their 21st day, but we want people to understand that there is a window, a grace period of up to 6 weeks. So if you don't get it on day 28, you can get it on day 29 or day 30. It's still effective. You do not have to start the series over if you're not exactly at the 28th or the 21st day.
Okay, so you said 6 weeks, meaning 6 weeks from the date of your first dose or the date from that 21 or 28 day period?
From the date of the first dose.
Of the first dose. Okay, that's good to know for people. So you mentioned the Janssen vaccine, and I think everybody's heard about the pause that we took with that vaccine. Do you want to address that a little bit?
Sure, and we understand that it's caused a lot of concern and it's been in the media a lot. So we want people to really get the message that the benefits of vaccination outweigh the cons of vaccinating. So we want people to understand that Johnson & Johnson is our only single-dose vaccine. It's very effective. Both the ACIP and the CDC have approved this vaccine for emergency use authorization. It's been reviewed. It was on pause because we had some people have some issues, mostly women, with blood clots, and that needed to be addressed, and that needed to be added to the fact sheet that's given out when you receive your vaccine. So the Johnson & Johnson vaccine is safe and effective, and we want people to understand that those benefits do outweigh the cons.
Okay, so when you said I think everybody knows CDC is Centers for Disease Control.
Yes.
The ACIP, what is that?
The ACIP is the Advisory Committee on Immunization Practices, and they're the ones that authorize the use of immunizations. So they're going to look at that vaccine and ensure that it's safe and effective for people to take.
Okay, we still have people that ask, is the vaccine going to make me sick? What are the side effects? Because they've heard from some people that they got very sick afterwards, and they want to know what to expect. Can you talk about that for a little bit?
Sure, and of course the side effects are going to vary based on an individual, but generally speaking, people can expect to have some soreness at the injection site, and some of the side effects include being fatigued, very tired, some nausea, some just general body aches and soreness, and those are to be expected. And people have an opportunity to report any severe side effects either to the provider that they received the vaccine from or to the Be Safe, which is a smartphone application, and they receive that information when they get their vaccination.
Okay. We are going to talk about some more questions that people have after we take this short break, so stay with us.
It was, just like any other shot. The EMT was very capable. He did a very good job. So, just took a few seconds, and I'm ready to go. No, I was waiting for the opportunity to get to my number, and I think everyone should take the opportunity as soon as it's available to them, because that's how we protect ourselves, our families, and our communities. We're all in this fight together, and everybody needs to do their part. A few seconds of the vaccine does not compare to having COVID. I had COVID. So that's something that you don't want, and you don't want that for anyone in your family or anyone that you know. So we need to all get ready, get in our cars, register, take the vaccine when it's available to us. And that's the best thing we can do for our communities. That's the best thing we can do in terms of getting us back to some semblance of normalcy. Our children can go to school, we can go to events and things like that, but we can't do that unless everyone does their part.
And welcome back. We're going to continue with some of the questions that we've received at the health department about the vaccine. The next question that a lot of people have, since a lot of people have already had COVID-19, if they've had it, do they need a vaccine, and how long do they need to wait to get one if they've had COVID-19?
Okay, so you asked a couple questions in there,
right.
So I'll start with the first one. If you've already had COVID-19, the vaccination is still recommended for you. And the reason is that we are unsure as to how long the protection you have once you've had the virus already. That is unsure. So because of that uncertainty, we want and encourage, even if you've had COVID-19, to still get vaccinated. Now, if you have had COVID-19, we want to clear up some confusion, because in the beginning it was thought that you had to wait 3 months before you could get vaccinated. That is no longer the case. The CDC recommends that as soon as you finish your isolation period after having COVID-19, that you are free to go ahead and get the vaccination at that time.
Okay, that's good to know. Now, what if you have received a different type of vaccine? I know a lot of our elderly population get the pneumonia vaccine, shingles vaccine. What if they've had one of those but they want to get the COVID vaccine? How does that work? Is there any time that they need to wait between that?
Yes, so there is time. There's 14 days that you have to wait if you received another vaccine before you can get the COVID-19 vaccine. So say, for example, I got my shingles vaccine today and I have a COVID-19 vaccination appointment tomorrow. I'm not going to be able to get that vaccine. I have to wait a full 14 days after my shingles shot before I can get the COVID-19 vaccination.
Okay, say in the case of the Moderna vaccine, where you get the first dose and then you wait 28 days, is it recommended or advised that say after those first 14 days you get a shingles vaccine and then you get your second COVID vaccine, or do you need to completely wait for the COVID series to be finished before you get any other vaccine?
The only requirement is that you wait 14 days between those. So you don't have to wait for the full 28 days for you to go get the shingles shot, as long as it's 14 days between the shots.
Okay, talk a little bit about the need for a booster shot. We've heard a lot of that talk lately about, how long the effects, the vaccine lasts, and whether or not we need to get a booster shot. So talk about that a little bit, because I know people want to know.
Absolutely, and we're all asking that same question. And currently there is still an unknown about how long our vaccination protection lasts. So with that being said, at this time, there is no recommendation for a booster. A booster does not exist yet. So just stay tuned to see if anything is going to change in that realm.
Okay, the next question we've had is one that's close to you. What do people who are pregnant or breastfeeding What is the recommendation for those people?
So currently the recommendation is that you discuss that with your provider. If you're pregnant, discuss that with your OBGYN. If you're breastfeeding, you may want to discuss that with your pediatrician or your primary care physician, just to understand what's right for you at this time. It is currently available for people who are breastfeeding or pregnant, with the recommendation not to get the vaccine in your first trimester. But again, that's totally contingent on the conversation that you have with your provider to make that decision for yourself.
Okay, that's good to know, very good to know. We're seeing vaccine hesitancy in a lot of different areas, but some people are concerned about the need to have an ID when they go to get a vaccine. Do people need to have an ID when they get a vaccine?
So when you come to public health, any of our health departments to get vaccinated, or in the community where public health is vaccinating, you do not have to have an ID. We ask that you bring one if you have it. We also ask that you bring insurance, your insurance card if you have it, but it's not required. If we do not want there to be any barriers to anyone in our community getting vaccinated. So if you don't have an ID and you haven't been able to get one, please come and still get vaccinated with us.
Okay. Another question is, when are people considered fully vaccinated, quote unquote, fully vaccinated? So
there's two ways that you're going to be fully vaccinated. If you are going to receive the Johnson & Johnson vaccine, it's a single dose vaccine, so you're fully vaccinated 2 weeks after you receive that first dose of Johnson & Johnson, that single dose. Mm-hmm. If you receive the Moderna or the Pfizer, you have to wait until you receive your second dose, and it's been 2 weeks since you received that second dose, then you're considered fully vaccinated. So 2 weeks after the single dose Johnson & Johnson, or 2 weeks after your second dose of Moderna and Pfizer, you're considered fully vaccinated.
Okay. Another question people have is the vaccine free, and do I need insurance to get it?
And the answer to that is no. You do not need insurance to get vaccinated, and it is free. So any provider that you go to right now, they may ask for your insurance if you have it, but if you do not, you can still receive the vaccine, and it is at no cost to you.
Okay, well, now we have a new registration process at the West Central Health District for our counties. So when we come back after this short break, we're going to go through the registration process for making an appointment to get a COVID-19 vaccine. Stay with us.
I was delighted to receive it. I couldn't wait to get it because there have been so many people that I have known, and so many funerals that I have had to be a part of, virtually or otherwise, who has succumbed to COVID-19. The way that the pandemic has been devastating people across the world, people in our community, people that I know, there was no way that I would not take the vaccine. I have every confidence in the science and the people of the United States and the FDA, who are responsible for monitoring and making sure that it's safe. It's a very, very dangerous and deadly virus, and it's one which all of us need to be protected from. Also, for people in the African American community, it might be of interest to some. There was an African American woman who was one of the chief developers in getting the vaccine developed. I think we owe it to ourselves, we owe it to our families, to our grandchildren, our parents, our friends and neighbors to make sure that we can do our part.
When we first got the vaccine, we had quite a long wait list since the availability was so in short supply. Now we have a new registration process that we are going to discuss today. Dr. Hiltz, we've got some slides up to show people the screenshots of what they will actually see when they go to the website to register for an appointment. So we're going to walk you through that registration right now.
Okay, so what you're looking at right now is our West Central Health District website, and that's westcentralhealthdistrict.com. And you can see on there that on the very first slide there in the blue, there's a COVID-19 vaccine link that you can click on to register to get a COVID-19 vaccine. Also in the red bar at the top, it allows you to click there so that you can go directly to the COVID-19 vaccine registration.
The people will not be on that page, though.
Yes.
However,
These little people that you see pointing,
Yes.
we're just using so that you can understand where you should go, either to that red bar or to that blue box to click for COVID-19 vaccine registration. Okay, so on the next slide, you're going to see that this brings you to our State Department of Public Health COVID-19 vaccination appointment system. And it's going to ask you several questions about your demographics, where you live, your history, your work status, which vaccine you're receiving, either your first or second dose. And when you click on this blue button that says proceed to the questionnaire, it's going to ask you all of those questions so that it ties you to the right vaccination clinic.
on the next slide.
Okay, on the next
Yes.
slide. So these are the steps to make your vaccination appointment. Here, you're going to put in your demographic information, where you live. You're going to complete the questionnaire, your medical history. It asks you questions like, is this your first or your second dose? So that way it ensures it attaches you to the right and appropriate clinic. Then on the next slide is going to allow you to select a specific location for either your dose 1 or your dose 2 vaccine. So when you're on this, utilizing the system, please make sure that you're using Google Chrome. That is the most effective platform when you're making your vaccine appointment. And once you get to this page, it's going to show you all the locations, whether it be the Columbus Health Department or Shirley B. Winston Recreation Center, or all of the locations that we have around Columbus. You'll get to choose one to book your appointment. Okay?
That's really handy to have. It gives you a little map too, so you can see exactly where you need to go. If you don't have the time, or you can't make an appointment in Columbus, you can go to Harris County or Talbot County or wherever else you need to go.
And speaking of going to surrounding counties, in this little bar that's above the map, it will automatically insert your zip code, and it defaults to 5 miles, but you can change that to 100 miles so that you can see where are some surrounding locations around Columbus that you can go to get your vaccine appointment.
Okay. Well, now that we have much more availability on vaccinations and the supply, there are some of our counties in the West Central Health District that have kind of set times where they're giving vaccines, where they would like you to come and get a vaccine even if you don't have an appointment. And I think we have a list of those, first of all, in Columbus, at the Columbus Health Department.
Okay, and you can see those on the screen now. So on Monday, Wednesdays, and Fridays, you can come to the Columbus Health Department between 9 and 11, although we strongly encourage you to make an appointment and register on that vaccine appointment system. If you cannot do that, we want you to still come to the health department, even without an appointment, on 5601 Veterans Parkway, Monday, Wednesday, and Friday, starting at 9 a.m. You can also visit the Chattahoochee County Health Department on Tuesday, starting at 12:30, the Marion County Health Department on Thursday, starting at 9, and also on Thursday, the Webster County Health Department, starting at 9 a.m. So we do have some opportunities for people who aren't able to make an appointment.
Right, and you can go to our website and see the address and location on the map, and a phone number if you'd like to call them ahead of time. You are certainly welcome to do that. Right now we are going to take another quick break, and then when we come back, we're going to let you know about some services that we have for people who are homebound and may not be able to get out to get a vaccine. So we'll be right back.
I have received my vaccine. I've received both doses, as a matter of fact. Like most people, I was a little bit hesitant at first, but I did some research. I looked up the information that the CDC had to offer, and I'm familiar with the way vaccines work because of my previous work history. And so I felt comfortable after I did my own research, and I decided that I would go ahead and take the vaccine. The main reason that I decided to get the vaccine was because first, I wanted to protect myself. And also, I have a wonderful granddaughter. She's 3 years old. And I want to be around to see her grow up. I want to be healthy. And I want to be with her as she goes through her different milestones. And so I knew that if I took the vaccine, that I would be protected from coronavirus. I am a retired public health nurse. And I gave lots of vaccines throughout my lifetime. And I also supervised nurses who did the same thing. And it was very rare that we would see individuals with side effects, but we could see the impact of the vaccine on preventing disease. And it's the same thing with the coronavirus and the COVID-19 vaccines. I think that if you get the vaccine, you can protect yourself, you can help protect family members, you can protect healthcare workers. And we have so many healthcare heroes out there who have gone above and beyond to take care of individuals who have been exposed to COVID-19 and who came down with COVID-19. And I think that if you get a shot, you not only protect yourself, you can protect your loved ones. And we all want to be around to live long and healthy lives. And I think this is one way that you can do your part to help be a part of the solution and not a part of the problem.
Welcome back to This is Public Health. We are talking to Dr. Asante Hiltz, who is our District Program Manager, about your questions and information about the COVID-19 vaccine now that we're a few months into it. Right now, we mentioned about people who may not be able to get out to a location to get a vaccine, maybe people who are homebound. What kind of services and how are we helping those people?
We're excited that we have the opportunity to take our team of clinicians to the houses of people who are homebound. And if somebody is homebound and they need the vaccine, they cannot come out to our health department or to one of our sites to get vaccinated. All they need to do is call our call center, and I'll make sure that we put the phone number up for our call center, and let our call center staff know that they are homebound and they can't get out, and we will schedule a time to come over to their home and provide the vaccine to them inside of their house.
Okay, and they can also visit our website at westcentralhealthdistrict.com. I think we have a slide up for where to go on our website. On the vaccine information page, it tells you if you have interested in homebound COVID-19 vaccines. And then on the next slide, I believe it shows you able to come out and get it. That's just one of the places that we are going to at the health department in our district. We've had vaccine clinics in many different places. Talk about some of the places that we have journeyed to give people vaccines and what's on the horizon for us.
Our health department staff believes and understands that everybody is not able to come to the health department during business hours to get a vaccination. So with that being said, we have made plans and we've already gone out to some fire stations, to some recreation centers under Park and Recreation for the City of Columbus. We've gone to homeless shelters. We have gone to some senior housing sites, as well as just some general pop-up sites. We have gone to some school parking lots, high schools, and the goal that we have is to make the vaccine easily accessible and available to everyone. So we're coming to a community near you.
Okay. Now, I know that there are some plans in the pipeline to maybe get with businesses or other agencies. If someone has a business with several employees and they would like to see if we could come out and vaccinate their employees, how do they contact the health department for that?
We're excited about our partnership with the Chamber of Commerce and several Chamber of Commerces over our 16 counties in the West Central Health District. But if you are a business and you have over at least 50 employees, please call our call center and let them know that you're interested in having us come to your place of business, and we will set up a vaccination site for your employees.
All right, that sounds great. We're going to take a quick break, and then we'll be right back and wrap things up.
It didn't last long. It wasn't. It didn't hurt, and it's the right thing to do for me, my family, and for this nation, for this state, for my city, because things have really changed for all of us across this nation, and we need to get back to some sense of normalcy. Initially, I must say that I did. But when I realized that the vaccines are safe, I realized that this is what's going to allow us to start to get back to a sense of normalcy. It's the right thing to do, and so I stepped up. I'm glad I did. My wife, my family members, to include my parents, we've all been vaccinated now. And we want to help get back to a sense of normalcy even in my own family. We were not able to get together during the holiday seasons, and now I think that we can gradually move back with all the safety measures in place to a sense of normalcy for my family. Obviously, I think they've got to make their own decision, but if I could recommend to them, I would recommend to them that they study it. They will learn that it is safe. They will learn that it is the right thing to do for our country, for our state and our city, and for their family.
Okay, we recently talked about some different places where you can go to get the vaccine if you can't get to the health department during business hours. So, Dr. Hiltz, what are some other outreaches that we are using at this time?
One of the most successful outreach that we've had is with our church and our faith-based partners. We've been able to come on site in church parking lots and offer the vaccine to church members as well as those in the surrounding community of that church. And now we have also added the opportunity to have a vaccination clinic set up after church service on a Sunday. So if your church is having in-person services, or even if you're not, if you would like us to come over on a Sunday after your in-person or virtual service is over so that people can drive through and get the vaccine, please call our call center so that we can develop and come up with a date and work with your church members or your faith-based members to set up a vaccination site at that church or synagogue or place of worship.
Okay, and that number is on your screen now, 706-653-6613. If you're interested in having the COVID strike team come out and vaccinate your church members, or if you have any questions at all about COVID-19 or the vaccine, please give us a call. The call center lines are staffed Monday through Friday from 8 to 5. So thank you so much, Dr. Hiltz, for joining us again and giving us this good information that we all need on the COVID-19 vaccine. We appreciate it.
And thank you for having me.
All right. And thank you for joining us for this edition of This is Public Health. We'll see you next time.